experience, solve it yourself. Try it and do what. Or certainly, when I'm doing correction for the CK, you can. So that is why you should be in the class and record if you can. If you cannot, if I post the link, you go and do what? Listen to it to help you. Alright, so we'll start from dosage calculations. We'll start from dosage calculation. Now, in pharmacy, this term or thing that has to do with drug medicine, this term dosage always do occur. So you'll be hearing about the term dosage. So, and some of you here have an opportunity to work in other pharmacy or patent medicine shops or even hospitals, some of you, or maybe your parents are into such business. You must have been hearing those. So, in your own understanding, what do you think is dosage? Who can help us? Any idea? Every time you hear the word dosage, what comes to your mind? This is the attendance. You just sign, write your name, number, full name. Your surname should be in capital letter. Then your reg number. Then sign in. Just sign in. Before I read the last two words, you sign again. Take my attendance seriously. You write your name, you pass it on. So as the attendance is going, let me hear you. Any idea? What comes to your mind? Whatever you need the time to use it. Any idea? Okay, thank you. So, quantity of drug is nice. So if you come to my class now, I'll give you 5 packets of drug. Medicine is a dosage. Is that what it is? Any other? What's the name? Okay. So what do you think? The frequency. Is better than your time. What's your name? Like who? That's it. What do you think? Dosages or dose? Anyone? Okay. Sit down. What's your name? So what do you think? That's expense. What's the name? Okay. Amount of drug taken at a particular time. Okay. What's the name? Keep it clear. Okay, so tell us. Dosage can be defined as the amount of medicine to be taken at a particular time. Okay. What's the name? Okay. We take it. Okay, tell us. What's the name? Okay, let's see. What do you think? Not the difference that dosage and those people are not the same thing. Okay, but sit down. Wow. That's done. Sit down. Anyway, you guys tried, but there's something missing. There's something that is what? Yes, now let me explain. When you say dosage or dose of a drug, the amount of drug taken at a particular time, because something is lacking for a particular therapeutic purpose. Are we together? Yes. Yes. To achieve a particular therapeutic purpose. Yes. Maybe your therapeutic purpose what you want to achieve is you want to take care of your what? Headache. So let's assume if 500 milligrams of paracetamol taken, depending on the age anyway, taken, for example now, 3 times a day, particular time, frequency is also there, can take care of what? Headache. That means that is the dosage of the what? Paracetamol the patient needs. Does it make sense? Does it make sense? So you must add for a particular what to achieve a therapeutic what or outcome. Very important. You must add it in the definition. It's not just the amount of drug. It's not just about what kind of frequency you want. You also include a particular what therapeutic what outcome. Because that is the outcome you want that it will make you to even go for the what the medicine in the first place. Or that made the prescriber to prescribe the medicine what for you. Hope you know the difference between medicine and drug. Do you know the difference between medicine and drug? Who tell us? I don't know what do you do between medicine and drug? Tell us. So what do we do with medicine and drug? Tell us.
First, drug can be abused, but drug can be defined as chemical substances which when taken
Who just hit no long story, just hit the point, the difference between medicine and no long story, just hit it down. I want someone that just hit it. The punch line, just punch and no long story. Difference between medicine and drug. At least how it will help you know what if you know actually the difference. That is something you know. So who can tell us the difference between medicine and drug? Just keep the main point, no long story.
drug is a chemical substance which when taken can affect the respiratory function of the body.
Okay.
While medicine is a chemical substance,
Yeah, right. Two levels. Okay.
Drugs are the first to those ones that can be abused. Why medicine are the first to those ones which can be used to treat therapeutic purposes.
Any other idea? You will move medicine and drug. Okay. Actually, let's not go start on it. That's not important. Even though you need to know it. Now listen here. Listen here. I'll just use what you know to explain what difference between medicine and drug. Listen here. Apart from the issue of being abused or not being abused, the issue of being a medical substance or not, the major thing, an identifiable difference between medicine and drug and not. You don't need to go and cram anything. Watch. If you want to who among you knows how to play the ritual. Good. And now listen carefully. If you go to market to buy a goosey, right? You buy the raw goosey, right? Now you buy the other ingredients, right? You want to buy the goosey. Now let's assume you go upon getting home now. You now put all the other ingredients and forget to put the goosey. Did you put the goosey? Eh? Now, have you heard of active ingredients? Huh?
Yes.
In a goosey soup, can you tell me the active ingredient there? The goosey, right? That is what makes it a goosey soup. True of us. Now, liking the egusi itself, the active ingredient as the drug, and the egusi soup as the what? Medicine. Egusi soup is a product of what? Egusi. Is a formulation of what? Egusi. Now, medicine is a drug product. Medicine is a product of what? Drug. Now, the same way you get the active ingredient, which is the drug itself, and add other excipients, you know excipient, right? And add excipient. Excipients are other ingredients that you need in the formulation that are not the active ingredient, right? To be able to produce the formulate the medicine or dosage form. If you want the medicine to be in tablet form, you make it to be in tablet form. You want it to be as to be in syrup form, you make it to be in syrup by adding other active ingredients. If you get paracetamol tablets, get paracetamol syrup, get paracetamol injection, get paracetamol suspension. All of them are products of what? Paracetamol. These things are what is called dosage forms. Did I call it dosage form? Or call it medicine? Or call it drug products? They are the same thing. So all these things you use the same paracetamol, which is active ingredient, to produce. These things are called the what? Medicine. They are what? Medicine. But the drug is what? The paracetamol you use in this preparation. Remove the paracetamol from that medicine. It's no longer paracetamol tablet. Two of us. You just empty what is in there. No active ingredients in there. Does it make sense? So this is the major. I don't want blowing grammar whether this one is abused or not. This is the main difference between what? Drug and what? Medicine. So if you are describing talking about what to give to a patient, you don't give drug to a patient, you give medicine or medication. You call it medicine, medication, drug products, or what? Dosage form. This form, one of that product center. You give medicine to the what? To a patient. You don't give drug to a patient. You know why they say that those drugs is prone to abuse? Now, for example, now you know before you formulate it as a medicine, the dosage has been established when they discover the what? The drug. Everything about the drug has been established. The dosage, the frequency of administration has been established. Now, when you now want to prepare the medicine a patient needs to take, you now make sure that you get the required amount of that drug that you need to put in the medicine, in the formulation of what you want to prepare. These are the ones the patient should do or take. Someone abusing paracetamol or cocaine is can be likened to someone that just went to market. You just enter one shop because you heard that you like egusi soup. You go and pack egusi, roll egusi without even measuring the cup or just pack the egusi and start eating it like that. Do you think you will survive it? Eh? But it's not the same egusi you get small quantity and prepare as soup and enjoy. If you now go to the market and pack it like that and start eating it like that, you have issues. The same thing with someone that just go and take it to rub as it is and start consuming it. No standardization, no dosage, nothing, just start consuming it. That's why they have issues. That's why they have what? Issues. And that's why the government clamp down people selling drug as raw drug. It's dangerous to health. And that's why pharmacists, those in the pharmacy field are licensed to take it, but they know that these things, if not well managed or used, can cause health problems. Majority psychological issues. Am I completing? So drugs are poisons. Drugs are poisons. If you use them well, it's welcome to. If you don't use them well, trouble. Now, you now understand the difference between drug and what? So everything is just trying to explain more the differences. But this is the key difference between identifiable and you can say, okay, this is drug and this is what? Medicine. So if you say paracetamol, if you say metronidazole, different metronidazole with flagyl you have different, you have the tablets, you have the suspension, you have the infusion, two of us. All of them still contain the same words, metronidazole. So those ones, infusion, metronidazole infusion, metronidazole tablets, metronidazole suspension, those ones are what? Medicines or medications or drug products or what is it called again? Or I mentioned medication drug products or you call them what? This one. Okay, now back to the one with there. I say that what is a dose? A dose is the quantity or the amount of drug or drug formulation taken by or administered to a patient to achieve a what? Therapeutic what? Outcome. A drug, a dose is the amount of drug or drug formulation given to a patient or administered to a patient. You know when it's administered, right? Or taken by a what? A patient to achieve a what? Therapeutic what? Outcome. Therapeutic outcome. Therapeutic what? Outcome. That is a dose. That's the meaning of what? Dose. Now, do you know having no difference between drug and medicine? Do you now believe, do you now align with me? Do you stand with me to say that it's important that dosage is calculated to avoid what? Problem. True of us. That's why we are doing this one. Dosage what? Calculation. Now, there are some terms I want us to look at. There are some terms I want us to look at. Under the dose, so if you are saying, okay, now let me ask you a question now. This thing is clear now. What is the dose of paracetamol? The dose of paracetamol for an adult is what? A dose of paracetamol for an adult is what? The dose is what? For an adult is what? How many? Talk like a professional. Talk a milligram in the amount, not just quantity, in the amount. Okay. How many milligrams? So how many milligrams? How many milligrams? 100 milligrams. So for an adult now, for an adult now, the dose of paracetamol is how many milligrams? 1,000 or 1 gram. Who will know that? 100 milligrams is what? 1 gram. Are you aware? So that means a dose of paracetamol for an adult is what? 1 gram. Now, from your little experience since you are born till now, how many times do you take paracetamol in a day? That dose for an adult is how many times a day? What the frequency? Frequency is what? 3, right? Morning, afternoon, night, right? So the dose, then if you are now asked now, this is a simple dose. A dose of paracetamol now. For an adult is what? 1 gram. If you now ask, what is the daily dose of paracetamol for an adult? 3 grams, right? Does it make sense to you now? Does it make sense? So the dose of paracetamol for an adult is what? 3 grams. Because you take it 1 gram morning, 1 gram afternoon, and 1 gram what? True of us is what? 3 grams. Now, please, before we proceed, I want to distinguish between two things. Those are what? Strengths. Those that strength are not the same thing. Because with time you start getting used to this. So you don't get confused when the time comes. Those and strength are not what? The same thing. As we said here, those of the drug is the amount of drug or drug dosage dose that is administered or taken by a patient to do what? Achieve the therapeutic purpose. That means dose of a drug is drug related. It comes from the drug and individual. Now, the strength of the drug deals with how the drug is presented by the manufacturer. Okay? The strength of a drug has to do with how the quantity the manufacturer presented, packaged and what? Presented. Sometimes dose and strength of a drug may come together. If you look at it as the same thing, but they are not one, the same thing. But sometimes they may not coincide. Now let me use the same paracetamol as an example. For an adult who has seen paracetamol before, who have seen paracetamol, let me use as an example, or let me use who has seen it before. Now, if you look at paracetamol, what will you see? Paracetamol, how many milligrams? 500 milligrams, right? That 500 milligrams is the strength of the paracetamol inside the what? The amount of the strength of the paracetamol inside that what? Tablet. Inside that one tablet, you have 500 milligrams what? Paracetamol. It is not the weight of the tablet. It is the amount of paracetamol put packaged and put it inside that one tablet. So that is the strength of the what? Paracetamol. As an adult now, like you want to take paracetamol, you take 500 milligrams. The one you take is the dose meant for your age, which is what? Which is 1 gram, 1,000 milligrams. But it is presented as what? 500 milligrams. Does it make sense to you now? So this is the difference between what? Those and what? Strength. But for a child, say a child, about 10 years, 8 years, 9 years, you give one tablet, right? Which is 500 milligrams. The dose for a child that age is 500 milligrams. Dose. But it just coincided with the strength of the what? Paracetamol. If you look as if they are the same thing, they are not what? The same thing. Am I completing? Even recently, I think EMSA also have, they have the one that the paracetamol that's come to 1 gram. They have 1,000 grams of what? Paracetamol, 1 gram. Now, for an adult that want to take, maybe I want to hear where you work now, and you want to give me paracetamol as an adult, and the one you have in your shelf is one of 1 gram by Emerson. And I need this paracetamol for like 3 days, morning, afternoon, night. As an adult, I need 1 gram, morning, afternoon, night, for 3 days. What quantity will you give me as an adult? If what you have is one of 1 gram in your shelf, what quantity will you give me? How many tablets will you give me? Yes. 9. As an adult, right? And you tell me to take it 1 gram 3 times a day, right? But what if I'm coming to your pharmacy or in the office, and what you have in your shelf is the presentation, the strength is what? 500 milligrams. As an adult, I need 1 gram 3 times a day for 3 days. How many tablets will you give me? 18, right? I mean, I say that the strength and dose are not the same thing. Do you not agree with me? That is the same. So these things are what you come in contact with in the course of your study. So you don't get confused when you get it. They are not the same thing. Strength has to do with how the company manufacture, maybe from the literature. And some company may be smart enough. They will still give, since the dose of this paracetamol is 1 gram per adult, let us package it as what? 1 gram. It's a marketing what? Strategy. So that the patients will not have issues drinking so many tablets at the same time. It's a marketing strategy. Because some patients, they begin them 2 tablets, it's good for them. Company just look, since an adult, and you just take one tablet 3 times daily. I'm sorry, 1 gram. Why not package it as what? 1 gram. For such adults, they do like that. Once the patient comes, you give the patient just 9 tablets, just take 1. There are people that if they see 2 tablets, they go and break. But if you just take 1, you are going to put it. So can you buy this one? The marketing word strategy. Does it make sense? Now, what if maybe the child is maybe around 3, 4 years, 3, 4 years, 5 years? In that case, now you need to take 250 milligram of what? Paracetamol. Now, for such child, I'm coming to your pharmacy, and they don't have money to buy syrup. Because of course, tablet is cheaper than what? Syrup. Because you are paying for the bottle, you are paying for the compounding, the compound formulation. But tablet, the simple thing, a full sachet of paracetamol that has about 12 tablets, 500 milligrams, is around 100 now or 150. But you can use it to treat a child of 4, 5 years that can swallow, or even you can crush it, and you can introduce such a person, such child, at a very cost-effective rate than using what? Suspension of syrup. But those ones are important to improve compliance, but there are some children that cannot swallow that tablet. Even the test. But there are some children that can just collect the tablet from you, put it in their mouth and chew, and drink and go their way. I've seen them. So people differ. Now, that was one for those that don't want anything bitter. It will help them. It will help to improve compliance in those patients. True of us. Compliance is that the patient will take the drug as a well without stopping it. True of us. So it will make them to do what? Comply. But the major thing there is that if you have such child that will take 250 milligrams, and you have in your shelf sachet that comes in tablet, 1 tablet, 500 milligrams. But the dose of the patient is 250 milligrams. And the parent is see that they don't have money for the one suspension. And their child can chew that one. How many tablets will they give? If you are going to give 250 milligrams 3 times daily for 3 days, how many tablets do you think the patient can consume can take for that 3 days? Who will tell us? A woman and her daughter or her son are coming to your office or your pharmacy. They say that they need the child is being given blah 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 blah. But the from this prescription is to paracetamol for them is 250 milligrams for the child. 250 milligrams. You see something like this. You see something like this. You see something like this. Tablets, paracetamol, for example. 200 was milligram TBS. Hope you are familiar with this. Hope you are familiar with these terms. Because you see calculation, you see a lot of it. Times 3/7. This thing you are seeing now is a prescription. Now, tablet paracetamol 250 milligram TDS times 3/7. Now, this is what?
3 days.
3 out of what? 7 days. 3 for 3 days, right? This is what? TDS is what?
3 times.
This is what?
2 days.
This is what?
2 days.
This is what?
200.
It is not the strength.
Dose.
That is those. Because this is the prescription from the doctor to you to give to this patient. It's not strength, it's what? Dose. This is the dose you give to the patient, not the strength. The strength is now the one you have in your work pharmacy. You look at, for you to be able to deliver these doses, you check the strength of the ones you have in your work shelf. The strength of the ones you have in your shelf would determine the quantity you will give to the work patient. Does it make sense? So this is the what? Dose. This is not the strength. Because this is the prescription. This is exactly the dose you want to give to the patient. Am I completing? This is dose you want to give to the patient. And this is the problem. What type of name is this? What type of name is this? Have you done drug nomenclature? Have you done generic name? Brand name? This is what? It's not very number. This is what? This is what? And this is what? Tab is what? Dosage form. Yes. This one, I am leveling this now because we end here now. This is what? Dosage what? Form. This is what? Drug what? Nomenclature, okay? Which is this one, sister is what? Generic what? Then specifically. This is the what? Dose. This is the what? Frequency. Frequency of what? Administration. This is the frequency of what? Administration. While this is the what? Duration of what? Duration of what? Treatments. The term here is what? Dosage form. The paracetamol here is the drug nomenclature of the drug. Specifically, generic. Because paracetamol is what? Generic. Then this one I'm giving them is what? The dose. The dose. The thing here is what? Frequency of what? Administration. How many times the patient needs to take it? Why 3/7 is what? Duration of what? How many are they? 1, 2, 3, 4, 5. These are very powerful parts of prescription or regimen. Actually, this whole thing here is termed a regimen. What? Regimen. In a prescription, you have different regimen that make up a prescription. This is the regimen for what? Paracetamol. Okay? This is the regimen. From the dosage form, nomenclature, dose, administration, and duration. It's a what? A regimen. You can see a prescription that may be a one regimen prescription. A prescription can be a one regimen prescription. You may see a prescription of a that may have up to five regimens of different drugs. True of us. Maybe the patient also has malaria. The patient also may have malaria confirmed from the malaria test. They may write another regimen for what? Malaria treatment. True of us. Maybe another regimen for malaria treatment. And then also look at the patient is somehow anemic. Of course, they may write what? regimen for what? Hematinic. Maybe drug capsule, 2 of us, or syrup. And you also notice that the patient is somehow, the patient is somehow weak. And they may write reviews for another workflows there. So this whole thing, this arrangement. Arrangement contains the name of the drug, duration, dose, frequency of administration, and what? Duration. Make up a what? Arrangement. Does it make sense? Does it make sense? Now, before we go deep into that, I want to look at something. In the dose, we have single dose. I think we have experienced single dose here, right? When I asked you about, even though paracetamol is not taken as a single dose, but I explained something about the speed of the rate of the paracetamol is what? Variant is what? 1 gram, right? Now, that is single dose. But there are some drugs that you take at once. There are some drugs you take once. Once. Those drugs you call a single dose what? Drug. Just take them once. Or administer them what? Once. There's some patient that may have some infection, some may have some like gonorrhea, they just administer ceftriaxone injection once and stop. Okay? There's some patient that may want to deworm themselves, want to be dewormed. They may take albendazole 400 milligram per hour once and stop it. This is a single dose once. Am I committing? That will work in by one single dose. And when they want to, maybe they want to write it as a prescription. In a prescription, you see something like this. You see something like this. Tablets, albendazole, 400 milligram what? Start. Okay? This is what you see. Or maybe the patient has maybe gonorrhea or infection. You stop like this. Injection of iron ceftriaxone. Ceftriaxone 1 gram what? Start. Just what it means just one shot and stop. This is a single what? No. Okay. Okay. Now, apart from single dose, we have daily dose. I'm breaking down the dose now, okay? Apart from single dose, we have what? The daily dose. Now, single dose is that you don't take it once and stop. Am I communicating? Single dose is that you don't take it once or administer it once and do what? And stop. Single what? Dose. That's a what? Single dose. Then under daily dose, under daily dose, we have single daily dose. This is not writing well. Which one? This black one. We have
single daily dose.
Single what?
Daily dose.
Daily what? Dose. We have divided what? Divided what?
Daily dose.
Daily dose. We can also call this daily single dose or daily divided dose. Any of is okay. Now let me explain this. They are not the same thing. This single daily dose is not the same thing with single dose. see what I mean by daily single dose or single dose. There are some drugs you take once a day, maybe for like 5 days. Have you seen such drug before? You take it once a day, maybe for like, unlike single dose, once and stop. Single daily dose means that you take it once a day, maybe for like 5 days. Does it make sense to you? In such prescription, see what you see. You will see an example of such drug. There is drug for some BP drugs, some anti-hypertensives are taken like that, or even anti drug to use in treatment of what graphia, hyperlipidemia, cholecystinemia, the system. So like maybe you use anti-hypertensive, popular amlodipine. If you have something like this, amlodipine, maybe 10 milligram. You have something like 10 milligram. Some will write daily, okay? Times maybe like 1/12, 1 month, okay? Then some which are writing daily, COD. So you see OD. OD are daily economic incentive once a work day. You've seen it before now in your laboratory applications, right? So let us not waste our time there. But some you just see OD. So you just see OD, so daily. Okay? Now this is a single word, single daily word, or very single dose. So you may see some daily dose, you see divided daily dose. Divided may be sometimes it may be divided into two times, sometimes 3 times. So from 2 times up, you see something like this, paracetamol. You see paracetamol is divided daily dose, 2 of us, because it's 3 times a day, 3 times, right? There are some that are 2 times a day. Some antibiotics are like some artemisinin based combination therapy, like artemether right? Why is it right? There are some drugs that in such one you see something like BB. I want to get that. You see BB. Like that diclofenac for pains is BB, right? That diclofenac tablet 50 milligram BB. This is a divided daily dose. Even though there are some diclofenac that you see take 1 daily, sustain release. You just give 1 like 100 milligram daily. It will release small in the system until the day runs out. Okay? Now, this is divided what daily dose. Now, there are some also that you can take up to 4 times a day. Something like ampiclos. 2 of us, ampiclos. What is the content of ampiclos? It contains 2 drugs inside that portion. Ampicillin and what? Fluoxacillin. Ampicillin and what? Ampiclos contains. That's where the company got the name. Ampicillin. Prox from where? Fluoxacillin. So it contains ampiclos. Ampiclos 500 milligram contains ampicillin. Ampicillin there is 250 milligram, okay? And what? Fluoxacillin. Fluoxacillin there is 250 milligram. So making it was 500 milligram. It's a capsule. It's a capsule form. Now this medication is taken every 6 hours, 4 times in a day, every 6 hours. You see something like this, QDS. Have you seen it before? But because it is an antibiotic are normally given with time. You don't just say few years because the patient may not maintain the timing. Simply say every 6 hours. Simply say what? Every what? For antibiotics or anti-infectives. Because you need to maintain the timing so that the, the, the organism they are fighting, they can maintain the level in the blood, in the system, to be able to fight the organism. That's why you maintain the timing. If not, resistance will do what? Develop. Have you heard of resistance before? If not, resistance will do what? Develop. So it's very serious when it comes to anti-infective, be it anti-hermetic, be it anti-malaria, be it antibiotics, antibacterial. Try be it antiviral, antifungal. Try to maintain the time. It's very important. Okay. Now, if it's the one you take one day, try to maintain 24 hours interval. If it's one you take twice a day, try to maintain 12 hours interval. Like people are saying for typhoid, we try to maintain 12 hours interval. So you can be able to take care of the problem without resistance. And try to complete the duration. Maintain the duration of your treatment. Am I completing? Now, so this is what you expect here. Now for this ambiguous, I'm just saying for let's say this QDS means what? Every what? 6 hours. Because 24 hours has 6 hours into 4 hours. Alright, so now you also have weekly dose. You also have weekly dose. You also have what?
Weekly dose.
Weekly dose. You also have what? Weekly what? Dose. There's an anti-malaria, mefloquine. Have you heard of mefloquine before? Mefloquine. This mefloquine can be taken weekly. Mefloquine. Mefloquine 200 watts, 50 watts, milligram. The regimen for mefloquine, the dose is 250 milligram. I'm bringing regimen and dose now. What their relationship together, so you understand. A dose of mefloquine is what? 250 milligram, right? But the regimen is 250 milligram once a week, weekly. Two of us, weekly. That's the what? The regimen. Does it make sense to you? So you take mefloquine 250 milligram what? Weekly. Once a week, yes. Once a week. Now, you can take it for like 3 weeks or for depending on what the physician now, depending on the what you wanted. But the basic is that you take it 250 milligram weekly once a week. So that means if you to maintain that time, if you take the first dose, let's say on a Monday 8 a.m. Try as much as possible to take Monday next week the same what 8 a.m. By this you have maintained the 1 week until the duration of the what treatment. Does it make sense? Does it make sense? Alright. Now, but sometimes, sometimes some of these drugs that are maybe taking a single dose or weekly dose, sometimes you can repeat the treatments. You can repeat the what? Treatments. Like now, some of these anti-everything like Avenda, so you take one, maybe after like 2 weeks, or 2 to 3 weeks, you do what? Take it again. Okay? You can repeat those, depending. There are antifungals, maybe for those that are treating some of these maybe vaginal candidiasis can be using fluconazole, 150 milligram. You take it once, maybe after like 2 weeks or 3 weeks, you can take another one, depending. So you can repeat the dose, okay, or the regimen, depending. Alright, basically, let's continue. Of course, I told you that, of course, you know that the dose depend on the age, right? The age, the weight. Before the end of this topic, I will treat different formulas used to calculate dosage in children. But this is where the number issue normally, adults don't have much issue. But for children, issue normally arises. So we just treat how to dose in children using different formulas. So we'll get to that. And even how to read nomogram. That's what's called nomogram. Body mass index. You know about BMI. We do how to read it and how to use it to calculate the what, the dose and the body surface area. We'll get there. Now, I've defined dosage regimen here, right? Good. Now, let's look at formulations. Formulations. Let's look at what? Formulation. I've mentioned this, but I didn't call it formulation. I told you that drugs can be formulated in different dosage. Two of us. You can have the same drug, but you may have it as 200 milligram. You may have another formulation as what? 100 milligram. Two of us. These things constitute what? The medicine we talk about. Two of us. That's why you can have paracetamol 500 milligram, you also have paracetamol 1 gram, two of us. Okay, now let's continue. Now, in formulation, that's what I call hello? We have now, where let's stop please.
Formulation.
Formulation now. In the formulation of are you aware that a particular dosage form may have inside the formulation, you may have more than one active ingredient. Are you aware? Are you aware? A formulation may have up to 2 active ingredients. I told you something about artemether glucose. In that one tablet, you have artemether. You don't have much. Even ampiclos. In that one capsule, you have what? Ampicillin and what?
Because that's a
Two of them work synergistically to take care of the what? Bacteria. Am I complete? You can also have it in different drugs, packaged differently, formulated differently. Now, if the 2 or more active ingredients are in one dosage form, maybe tablet or capsule, it's known as a what? Fixed dose combination. It's known as what?
fixed dose combination.
Dose combination. Or simply what? FDC. Fixed dose combination. FDC. So this thing now is FDC. Two of us. You may go and say, so okay. And the next one, if it is not a fixed dose combination, it's a what? Kit. It appears as what? Kit. Maybe you may be telling somebody about the particular medicine. Say, nah, this medicine, what's the name again? Ampiclos. Ampiclos has ampicillin and glycerin inside it. You should ask you, is it as a kit or as a fixed dose what? Combination? As a physical combination, it means that the two of them are formulated in one dosage form, either tablet, they are inside the what? Tablet or capsule. But as a kit, they are different. We have different Who has seen ulcer kit here before? Ulcer kit. That's where it got the kits. Ulcer kit is used for treatment of H. pylori what? Infection. Are you okay that? Now that ulcer kit has about 3 different active ingredients, but they are formulated differently. In the same sachet, are they in the same sachet? But they are formulated what? Differently. If you want to drink it, you take this one, take another one, and drink. It has omeprazole. What is it? Tell us. It has omeprazole. It has what is it? Ulcer kit. Ulcer kit has flagyl. And what else? You see, I must say of flagyl myself. You don't take it, you don't don't want to get there. But the good one thing to know is that they are formulated individually on their own. Take this one, and do what? Take it in the morning. In the night again, you take this one, take another one, take. They are not in one capsule. So that one is a kit. But if they are together, let's assume that this ampicus has ampicillin in different capsules. So that's like in different capsule. And you want to take it, you open it and take. It's a kit. They will package it as a kit and give you. It's a kit. From the company, you don't package it like that. But if it is in one capsule or one tablet, it's what? A fixed dose combination. FDC. Okay? Now let's continue. All this while we'll be talking about tablet. Solid delivery. The dosage form are also important. Are you aware? And the dosage of that one, if you're not careful, it can be confusing. But I want to use practical question. I want to use a question to explain that one, to explain that one. I'll use question to explain that one. Well done. What do you have after this class? Different words. Like that, you may have a suspension. You may have a word. Suspension. That may be coming. It may come in as 125 milligram per 5 minutes. The same suspension may come as what? 250 milligrams per what? 5 minutes. Are we together? You must not have it as 125 milligrams per 2.5 minutes. Do you know what this means? Let's assume that this suspension. And this I'm sure of this one. This two. Let's assume that this suspension is amoxicillin suspension. Let's assume that it's amoxicillin. So what it means? What it means is that 5 ml of the entire. If you take 5 ml, you measure 5 ml of the suspension. 5 ml will contain what? 1 to 5 million of what? Amoxicillin. That's it. If this suspension is amoxicillin. If this suspension is what? Amoxicillin. What it means is that 5 ml of it will contain 5 ml of the suspension. The suspension is the medicine now. Hope you know. It is the dosage form. While amoxicillin is the what? The drug. What it means that 5 ml of the what? Of the suspension will contain what? Contain 1 to 5 milligram of what? Amoxicillin. That's meaning. That's the meaning. This, if you see that if you know that the strength is 1 milligram per 5 ml, what it means is that 5 milligram, 5 ml of the entire suspension contains 1.5 milligram of the what? Ammonia. This is the strength, it's not the dose, it's the what? Strength. How the company prepared it. In the preparation, packaging, the company prepared it so that 5 ml will contain what? 1.5 milligram of what? Ammonia. Now, a prescription may come and the doctor asks you in the prescription to give to a child of so years 250 milligrams of amoxicillin for like 3 times daily. Let me write it on the board. You may see a prescription like this. Suspension amoxicillin 250 milligrams. Remember what I told you about this. This is antibacterial, right? Antibiotic. Be careful. Try to maintain the time, okay? Even though they will say right 2 years for you, okay? Times 1 over what? 1 over 52. Let's assume you measure like this. Suspension amoxicillin 250 milligrams, 2 years times 1 over 52. Remember that TDS you want to give the patient, try to maintain the time in 8 hours. 8 hours. That the patient will take 250 milligrams what? 8 hours. The dose is 250 milligrams. When you see it as a pharmacy of multiplication, you now go to your shelf and look at the strength you have in your shelf. That at the same amount may come in different strength of this. Now, can someone tell me here? Let's assume that the bottle that contains this different strength, the bottle is 100 ml. 100 what? Ml. The bottle is what? 100 ml. 100 ml. Can someone tell me here? For the first strength, which is 1 to 100 grams per 5 ml, how many ml will you tell the patient to give to the caregiver to give to the baby? How many male balloons will the caregiver give to the baby? If what you have in your shelf is one that contains 1 to 5 milligrams per 5 ml, and this is basic show, is what you have at hand, and the baby and the mother is there, they looking at you. What will you tell the woman? How many male will you take the woman to give the baby? Will you now hand over the one you have in your shelf, which is 1 to 5 milligrams per 5 ml? How many male will you tell her to give the baby? 10 male, 3 times 3. Why you say 10 male? So why you say 10 male? I want to know why you say 10 male. We are entering from camp now. Yes, I thought I had the idea. Now look up. Hello, look up. Remember, the one you have in your shelf is what? 1 to 5 milligrams per 5 kg. That's why I said this is the strength. Okay? One is the dose. How many ml of this one you have will deliver 2 milligrams to the patient? If 5 ml of this one you have contains 1 to 5 milligrams of what? Amoxicillin. Now I want to give the patient 250 milligrams. How many ml will contain what? 250 milligrams. You do what? You call it what? X, right? You cross multiply. That means X is what? 5 ml. That means X is what? That means S is what? 5 mil times what? Times what?
250.
250 what? Milligram over what?
125.
125 mil. What milligram? What the answer? Milligram will cancel milligram. What the answer? 125 divided by 250 is what? 2, right? 2 times 5 mil is what? 10 mil. So you give 10 mil, you tell the woman to give, the woman have to give this baby 10 mil of this 3 times every 8 hours for like for 1 week. If you deliver, it's not true. Now let's assume the one you have in your shelf is what? The one that contains 2 milligrams per 5 mil. How many mil will you take in one product to give to the child? 5 mil. It's not true. Because the 5 mil contains 2 milligrams. But if you want to use, need 2 milligrams. So simply give what? 5 mil. Have you now seen? In concern with this one, right? But they're not the same thing. Those are straight and not what? You just agree states. Two of us. Now let's go to the last one. Last one, the strength is 125 milligram per 5 mil. 20.55 mil. So how many mil will you tell the mother to give to the child? If that's what the one you have in your shelf.
Five.
Huh? Are you sure?
Yes.
5 mil. 50.5 mil. Contains 1 to 5 milligrams. And we are going to give what? 250 watts milligram. Is X, right? X is what?
2.
Times what?
1, 2.
You are what? 125. 2 is 5 mil. So if you take 5 mil from this one, and you are delivering what? 250 watts. Milligram of what? Amoxicillin. Any questions so far? Any questions so far? Good, thank you. I just lost my level. Look at this one I entered. I lost my own. So maybe after you should tell me another two. Alright. Now let's continue. So from this thing we just did now, can someone tell me what you can deduce from this thing we just did now? Listen carefully. In as much as it's true that some doctors do it, but it's wrong. You don't say you don't write a prescription like this. Suspension and Muslim 5 mil TDS is very wrong. Can someone tell me why it's wrong? Can someone tell me why it's wrong? You don't write suspension amoxicillin, 5 mil, TDS. You cannot use that volume to get the exact dose you're looking for because the person, unless the person that wants to dispense the drug, you are very sure that the pharmacy, maybe you have in mind to give to treat a baby, let's say you want to use 250 milligrams to treat that baby, then you now go and write amoxicillin 10 ml. It's risky. Do you know the reason? What if the pharmacy, the one they have, 10 ml cannot deliver 250 milligrams? If you just write 10 ml, what if the one they have in the shelf is 250 milligrams per 5 ml, and you want to deliver 250 milligrams? You are thinking that the one they have is 125 milligrams per 5 ml. You go and write 10 ml TDS. One, the pharmacist or the person there will be confused. Then, if the patient is so unlucky, the one they have there is only one, which is 250 milligrams per 5 ml. You can give that one. What if the person there doesn't know much about this? You go and give 5 ml, tell them to take 10 ml. The patient will be taking 500 milligrams TDS instead of 250 milligrams because you wrote 10 ml. So the right thing to do is to do what? Write the dose in milligram. Forget about the ml. It's now left for them, the, the pharmacy, to know the one they have in the shelf that can give that 10 ml. Let's assume now, that can give that 250 milligram. And also, they will also consider the pocket of the patient. Let's assume now, those three strengths I listed here, you have 125 milligram per 5 ml. You have 250 milligram per what? 5 ml in your share. And the patient and the doctor now wrote 250 milligram TDS. You may say, okay, if I give 125 milligram per 5 ml, that means this they will take 10 ml of here. And the bottle is 100 ml. Under 3 days, it will finish. True of us. Then and if it finishes, they'll buy another one and continue. Now, but if you give the one of 125 milligram per 5 ml, if you give the one of 250 milligram per 5 ml, you just take 5 ml, and that 5 ml can last for like 1 week. True of us. Which one is more expensive for the patient? Giving 125 milligram per 5 ml. True of us, because you've taken 10 ml, that means they will need 2 bottles or more. But if you give the one that is 250 milligram per 5 ml, they will take 5 ml, it will deliver that 10 milligram, 250 milligram. For like 1 week, at least 1 bottle should be okay. Because if you divide 250, if you divide 100 ml by 5, you have what? 20, right? 20. And they will take it 5 morning, 5 afternoon, 5. So a day is what? A day is 15 mil. Okay. If you divide it by 5, maybe 2 bottles should be enough for 1 week. But the other one, they take up to 3 bottles. We call it cost effectiveness. I mean, cost effectiveness. Yes. Even though 2 of them treat the same disease because it's the same strength you are giving. But the other one of 250 milligrams per 5 ml is cost effective because they will spend more buying the one of what 125 milligrams. These are things you do to add value to your work. The person will say, this man has my interest at what? Heart. He doesn't want me to waste money. Tomorrow you come to your home because you know that you have his or her interest at heart. He will say, now. The person will just go, so you will make more money. You know, the more expensive a drug is, the more markup you will have. So you use like 20% markup. So if the drug is more expensive, you make more money. True of us. Or say he knew that he would make more money. Still, he advised me to take this one that will help me. Take it. Tomorrow you'll be coming. You have confidence in you, in your company, in your pharmacy, whatever. I'm coming there. Tell other. You tell their friend, please, this person is a person. Tell the truth. You're going to it. That one person that thinks that he is smart, losing customers. You that is sincere, doing the right thing. Your hard work will be bringing people for you because they have trust in you that you know what you are doing. In the rank of most trusted professionals in the world, I think pharmacists, by extension, pharmacy technician should be under item number 2 or 3. Because these are the people that will tell you the way it is. They expect them to tell you the way it is. They don't care about your money. They tell you the way it is. And it has been like that in the pharmacy, in the hospital where doctors and others are working. One day after prescription, after seeing doctor, his pharmacist is the last port of call. So a lot of lives are dependent on you. Any mistake you make at that point, and the person will take it and go. Two of us. So you are bound by virtue of to be sincere and say it to the way it is. Because you are there to monitor, to checkmate what others are doing. From there, from the pharmacy, a lot of mistakes are what discovered, even from different parts. But after that, the patient is going in. Once you leave pharmacy, it is going weird. You don't collect the drug and start going to the doctor again. No. I know that doesn't do again what happened. So you should maintain what integrity, no matter what. It's very important. Now, so that is from this thing. Now, I believe that if I give any question now on this, you can solve it, right? Right? I believe so. If you don't believe, believe in yourself. Now let's look at this question. Let's look at this question. Calculate the total number of tablets. Calculate the total number of tablets to be dispensed. Calculate the total number of tablets to be dispensed if a prescription requires 2 tablets of drug X 3 times a day for 7 days. Calculate the total number of tablets to be dispensed if a prescription requires 2 tablets of drug X 3 times a day for 7 days. What's the answer? I give you 2 minutes to solve it. What's the answer? 2 minutes. Your time starts now. What's the answer?
42 tablets.
42 what? Tablets. So how did you arrive at 42 tablets? Tell us. Go to the board. Tell us how you arrive at 42 tablets.
Two tablets
Okay?
of drug X
Okay?
daily.
Okay?
Then for 3 days. For
7 days.
for a day it will be.
Okay, a day is what?
For a day it will be 6.
Okay.
That is 2 times 3.
Which is what? 6 tablets.
Yes.
Okay, I agree.
Then for a week
Okay.
it should be 6 times 7.
Okay.
It should be 42 tablets.
Do you agree with him? Do you agree with him? So it's for 2 what? Tablet. Thank you. Thank you. Thank you. Okay, let's look at this and this question again. Under one. Let's look at under one. This one says a prescription requires 2 suppositories of drug Y daily. A prescription requires 2 suppositories of drug Y daily for 3/7. A prescription requires 2 suppositories of drug Y daily for 3/7, full stop. How many suppositories should be supplied? How many suppositories should be supplied? I'll give you 1 minute. 6. Wow, that's great. 6 what? Suppository. Good. 6 suppository. 6 suppository. Who is lost? Who is lost? I go to the board. It seems some people are lost. Go and tell us how you arrive at 6 suppository. Fast. Tell us how you arrive at 6 suppositories. These markers are not writing well. The class rep. You don't have marker here. Change it, remove them here. That they are confusing us. The one that is not writing well, you remove them. Maybe you refill them if you do so. Good. So what did you do?
That is 2 suppository. 3 days. Do it 2 times.
Okay. 2 suppository for daily, right?
Yes.
For 3 days. So 2 times 3 is what? 6. So if the patient needs 2 per day for 3 days, is what? 6 suppository for the 3 days. Who is lost? Are we all in the same page? Are we all in the same page? Now, all this while we'll be calculating for solid medication. Now let's look at liquid preparations. Let's look at liquid preparation and look at it. Let's look at liquid preparation. Of course, the example I gave here, the normal measurement is in ml. Remember, right? And a particular ml will deliver a particular milligram of a what? Drug. Remember what we did with amoxicillin, right? So a particular ml for the volume, in volume is a ml. A particular ml will deliver a particular what? A particular what? Dose of, right? A milligram. Now, the one we are going to look at now is the one for volume above 5 ml. The way you administer medications in volumes above 5 ml is not the same way you administer for those below what? 5 ml. Are we together? It's not the same way. Now let's look at above 5 ml and above. I think let me start. Let's do this with a question. Look at this question. The question says, this one now, of course, you use your what? You use your spoon, right? You know about 5 ml spoon, right? You know 5 ml spoon. You know 10 ml spoon, right? You don't know 10 ml spoon. Okay. You know teaspoon now. Teaspoon is 5 ml. You know desert spoon. Desert spoon is 10 ml. Desert spoon is 10 ml. You know tablespoon. Tablespoon is 15 ml. Okay, don't worry. We'll be talking about it. The material I sent you, just go through it. It's simple. Okay? But let's see how far we can go. We'll just be referring the same way as I talked about them now. More things that will come up from those things I sent you. We'll be discussing it like this, okay? So in measurement of volume is measured in what? Mils, okay? For metric system. We have different systems. We have metric system, we have imperial system, old system, and the new system we are in now, okay? Now, but in the metric system is in mils. Tablespoon, those ones are household measurements. We call them what? Household measurement. What you have in at home, used to measure something. So if you hear tablespoon is actually what? 15 mil. If you hear desert spoon, is actually what? 10 mil. If you hear teaspoon is actually what? 5 mil. We hear teacup is actually what? 120 mil. A teacup is what? 120 mil. Don't worry. Let's look at this question first. The question says, a prescription requires a patient. A prescription requires a patient to receive a quantity of indigestion mixture. A prescription requires a patient to receive a quantity of indigestion mixture with a dosage regimen of 15 ml 4 times a day for 5 days. A prescription requires a patient to receive a quantity of indigestion mixture with a dosage regimen of 15 ml 4 times a day for 5 days. How many 5 ml spoonfuls? Ebony, are you lost? Where? Huh? Okay. I said a prescription requires, let me say that fresh. A prescription requires a patient to receive a quantity of indigestion mixture with a dosage regimen of 15 ml 4 times a day for 5 days. 15 mils 4 times a day for 5 days. Full stop. How many 5 ml spoonfuls? How many 5 ml spoonfuls of the mixture will the patient require to take for each dose? How many 5 ml spoonfuls will the patient require to take for each dose? That's the first part of the question. Then the second part of the question says, calculate the number of doses. Calculate the number of doses and the total volume that should be supplied to the patient. Calculate the number of doses. Calculate the number of doses and the total volume that should be supplied to the patients. Where is the attendance? Calculate the number of doses and the total volume that should be supplied to the patient. Sign out. Sign out. We are about to end this class. All right, I give you 2 minutes to do that. Let me know the hot brains in this class. I give you 2 minutes to do that. 2 minutes, just 2 minutes. If you go back, tell those that are not here that we have started. And from Thursday, our CA will start immediately. I don't waste time. Pass it on, yeah, pass it on. If you go to your table, you sign out. Yeah, what?
The name that I was supposed to write, back before checking this.
I don't know what you mean.
As in the paper, the paper is on this. So I wrote the name here instead of.
At the back. Why did you do that?
So I see it.
Why did you make such mistake? Let me see what she's talking talking about. But have you written it here? Okay. You're welcome. All right, what's the answer? This one did. Huh? What's that? It's difficult. That's simple thing. What do you get? A whole you. Hmm? Even you. Huh? Even Adora. Ha! No, 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 no. No, this is not happening. No, 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 no. It's not happening. It's what? All right, let's solve it before I go. I have very 7 minutes to spend here with you. Now, let's solve it before I go. They already started calling me in my city to come back. I have a lot of things to do in the office. Now, let's solve this before I go. Now, look up. There are 3 questions. I hope you know. 3 of us. All right, let's solve them. Are there 2 or 3? All right, let's see now whether there are 2 or 3. The question says, a prescription requires a patient to receive a quantity of indigestion mixture. You know examples of indigestion mixture now? You know now, Miss Mag, right? Example, good. With a dosage regimen of, the dosage regimen is this. They didn't tell us the name. Let's call it X, okay? They don't come in suspension. Suspension, hey. Suspension what? X. 15 what? Mil. 4 times Q. DS. Times for 5 days. The mistake most of you made is this. You just read solving. That is a prescription. Try to write that regimen first. It will be clear to you what you are solving. None of you did that. Write that regimen first. Whatever you are doing will be clear. With this now, this question is another solve. Hope you know. Because it's clear now. Forget those grammar that are blowing there. Put that wrong grammar in this form. You will solve your question. We are told that the regimen is what? We don't know. They didn't mention the name, so we call it X. And they are always in suspension form. So that's why you shake them before you throw of us. They are suspension. You done your dispensing now. You know what a suspension is, right? Good. Now suspension X, 15 mil QDS times 5 over 7. And the question now says, how many 5 mil spoonful of the mixture will the patient require to take for each dose? A dose is 15 mil. Area. So how many 5 mil spoonful are in 15 mil? 3. First answer. 5. They say how many 5 mils spoonful? That means a spoonful is 5 mil. So how many of it will give 15 mil? Because a dose is what? 15 mil. How many of it is what? 3. 5 mil spoonful. It's not true. First answer gone. Second one says, calculate the number of doses and the total volume that should be supplied to the patient. A dose, come on, sir. A dose, we are asked to calculate the number of doses. This is 1 dose, right? Look up. This is 1 dose, right? A day is how many doses? This is 1 dose, it's not. It's not. 1 dose is 15 mil, right? So a day is how many doses?
60.
A day. This is 1 dose. It's not. This is 1 dose. This is 1 dose. 2 of us. A day is how many doses? A dose contains how many mil? 15 mil. 1 dose is 15 mil. How many doses would we take a day? 4 doses now. Is not? A dose times 4 times. A day is 4 doses. It's not true. A day is 4 doses. You are confusing yourself with male and dose. That's the problem now. 1 dose is what? 15 ml. A dose is, you took a dose now, bam. They didn't ask you what is the content of the dose. They just said the number of doses. You will not ask how many ml is in that dose. You just ask what number of doses. A dose is, what that one equal more is 1 dose. It's not true. So how many times you take it a day? So you take 4 doses a day. 4 what? Doses in a what? Day. So how many doses will it take in 5 days? 20 doses in 5 days. So the person will take 20 doses in 5 days. Now the last question now says, did I want you to talk about the volume that will now be in that dose? It's not true. It's not true. So if the patient take 20 doses for the 5 days, and the dose contains what? 15 ml. So how many ml? What is the volume for that 20 doses? Duration of treatment. What's the ml? Simply multiply 20 doses by 15. It's not true. It's not true. If a dose is 15 ml, 20 doses is how many ml? 300 ml. So 300 ml for the duration of the what? Treatment. I know where most of your problem came from. It came from the confusion between the male and the dose. 1 dose is how many ml? 15 ml. It's not. 1 dose is 15 ml. That one more at a spot is a dose. So 4 doses in a day. Okay, if you want to take paracetamol, how many doses of paracetamol will it take a day? How many doses? 3 doses now. If I ask you how many tablets are in 1 dose, you can tell me 2 tablets for an adult. True or false? If I ask you how many milligram make up a dose, you cannot say 1 gram or 1,000 milligram for an adult. But the dose is 3 doses. The same thing here. A dose is 15 ml, but a day is 4 doses. So for the entire 5 days is 20 doses. What is the ml? What is the volume that will make that 20 doses? 300 ml. 20 times what? 15 ml, which is what? 300 ml. Does it make sense? Does it make sense? Are you done with the attendance? Have you signed out? I think we'll stop it for today. We'll continue on Thursday. So please, as I told before now, from Thursday, once I enter here, once I teach, I will remain 30 minutes, depending on what you have here. If we have up to 2 hours space, like today, I will just teach for like 1 hour, 30 minutes. The remaining 30 minutes, I will just roll something. That first topic, numbers and numerals, go and study it. Read the material I sent you, it's easy to understand. Read the material I sent you on that. Read the material I sent you on that. Try to solve those questions there. Okay? Solve those questions there. For numbers, what is a whole number, integer, those things are online. Look it up. Okay? Those ones are online. Look it up. Whole number, integer, the meaning of those numbers listed there. Look for examples of them. Try to solve that questions. Okay? If I come here tomorrow on Thursday after 1 hour 30 minutes, if there will be time, I'll just, if I call you, I don't, whether you tell those that are not here to go and study, whether they are here or not here is their business. They should go and study that topic. Tell them, class rep. Once you come here, after that, I will just, if I call you, you pick your question, you go to the board. I'll give you 5 minutes or even 3 minutes to solve those 4 questions. I will score you, the mark you. I will mark it correct, do correction and do what? And do what? Give your mark there. This is what we'll be doing until we finish 11 topics. So it's a serious thing. No time to waste. I'm impressed with their performance at this level. At least I'm impressed. The first impression I got from you people is encouraging. And I want you to keep it up. Okay? Yes. I say things the way they are. The first impression I got from him, even when I entered here, the impression was wonderful. And you people are always solving something. That's what it should be. If you know something, come out here, discuss it. Help those that don't know. Discuss it. Don't feel too big when somebody is there trying to discuss something with you. Open up and discuss. You may learn something from it. Even the person that is doing it is also learning more. So when there's no lecturer in your class, do things like that. Get each topic, do things like that. It will help you. I'm impressed, I must say the truth. And I want you not just that when I enter, if I ask you the way you answer questions and the way you participate is I am impressed, and I want you guys to take it up, to do what? Keep it up and do more than that, okay? So I think I will stop here for today. Is there any question? No question. So we'll stop here for today. See you Thursday. Please, 8 a.m. I'm here. Unless something happens, I will duly inform your class one time. But once it's 8 a.m., I'm here. And let you start. I don't wait for anybody. All right, please. All right, see you Thursday.